Phantom limb syndrome occurs when amputated limb nerves still send signals to the brain. Despite the limb's absence, the brain continues to receive these signals, creating the illusion of sensations in the missing limb. People with phantom limb syndrome may feel tingling, itching, pain, or even the sensation that the limb is moving or in a different position. Phantom pain is a significant challenge, where individuals feel pain in the missing limb. This pain can vary from mild discomfort to severe, debilitating pain, making daily life difficult. The exact causes are not fully understood. It involves a complex interplay of sensory, motor, and cortical reorganization in the brain. The brain's attempt to rewire itself after losing limb input leads to these sensations. Managing phantom limb syndrome is challenging. Treatments include medications like antidepressants or anticonvulsants, physical therapy, mirror therapy, nerve blocks, or surgery to alleviate symptoms. Phantom limb syndrome can cause frustration, depression, and anxiety due to persistent and unpredictable sensations and pain, affecting overall mental health.